Okay, let's get started with
All
the
right.
Sawyer County Health and Human Services Board meeting. Roll call.
Dale Schleter,
Yeah,
Marshall Savitsky,
here.
Jesse Betcher,
Here.
Michael Maestri.
Here,
I think I hear him. Is that him?
can you hear
Chris
me?
Ross? Lorraine Gouget. Don Pettit,
Here.
Carol Pearson. Yes. And Sabrina Dunlap. Here. You have a quorum.
Okay, let's. Allegiance.
Allegiance to the flag of the United States of America, and to the republic for which it stands, one nation under God, indivisible, and liberty and justice for all.
Do we have a quorum?
Yes, we do.
Okay, and we've been noticed all the,
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
okay. Everybody had a chance to look at the agenda. Is there any changes? Okay, that's good. Public comments, anybody in the audience? Okay, committee reports. Lorraine,
Do you want to do minutes first?
what did I forget?
Minutes?
Approval of last month.
Approve the minute.
Yeah, but I thought I was better get through it without me.
I'll make a motion to approve last month's minutes.
Thank you, thank you. All in favor, say aye.
Aye.
Motion passed. Thank you for catching that. Okay, committee reports. Lorraine?
Mr. Chairman, Lorraine was gonna come, so maybe we could put
Oh,
that
I
off
thought
for a
she
little
was
bit.
online. Oh,
Oh, is she?
No,
No.
I don't think
oh,
so.
okay,
So,
all right. Senior Resource Center.
I'll make it short and sweet. I've got to go take care of 20 pumpkin pies that I just baked.
Whoa.
Yes, for lunch tomorrow. Okay. Just kind of a recap. In December, countywide, we served over almost 2,500 meals, and that includes Meals on Wheels, carryouts, frozen meals, and we did about 100. Just Hayward alone did around 120 frozen meals over the holiday season because of being closed Christmas Eve and the day after Christmas and stuff like that. So we did that. So what we did is because we had so many, we kind of did them out over a week so that people had them. And then so anytime we know that, you know, we try to do that ahead. We ask people how many frozen meals they want. And so because we have a lot of people, not so much at the other sites, but in Hayward, we probably have 7 or 8 people that get meals 7 days a week. So on Fridays, they get a hot meal and then they get 2 frozen meals. And then we have one individual that just started now that gets 1 hot meal and 4 frozen meals every week. So it just all depends upon the person, but countywide, we did about 2,500 meals in the month of December. Because the rising costs of meals are right now, it's costing us about $14.35 to prepare each meal. So as of January 1st, the suggested donation went from $7 from $5. We kind of gave everybody like a month and a half to know that this was happening. We found little or no resistance when we said that we were going to do that. In fact, I think it was Stone Lake when they announced that this was going to happen on January 1st, they started actually raising their donations that they gave to that site in early December, late November. So right now, and we have individuals with their families bought them coupons for meals, and the families bought them at $5. They have come to me and said, you know how much they paid for their coupons? And I said, well, if they bought them in December, they paid, you know, $5 a piece. And they said, okay, well, we'll put that extra $2 in the box every day when we put our coupon in. So we've had little or no resistance with that price change. On average, we're getting 3 to 4 new Meals on Wheels participants every month. Supplies are still increasing. We have a lot of times when things we order we can't get. That's why I baked 20 pies a little while ago before I came, because the things we needed for the dessert that we were going to have for tomorrow, the supplies didn't come in. So we looked at what we had, and someone had donated 20 frozen pie crusts. So I made 20 pies a little while ago. So that's what we're having tomorrow.
Thank you.
Yeah. We still, like I said, we have a lot of supply issues. food is still increasing. I've used the example a couple times lately. Went to Walmart last week. They didn't have the gallon jugs of Miracle Whip or mayo, so I had to go to Marketplace. A gallon of mayo was $31.99 and a gallon jug of Miracle Whip was $18.99. So guess which one I bought? It wasn't the mayo, so they're stuck with the Miracle Whip now. We still and always will need volunteers. We have a lot of people that used to come and help in the kitchens that have either gone back to work or they've had medical issues or it's not something they want to do. Cook in Hayward, you need one sooner than later. My head cook is going out on medical leave the 27th of January for at least a week to 2 weeks. If we don't get someone in there, it will be me, which is fine. I've already planned for that. But we do need to get another cook because we also have the other cook that we do have, just 2 cooks in that kitchen. She's going out on maternity leave in April. So if you know of anybody that wants to cook, wants to be around seniors, send them our way. Okay. Bus ridership is increasing. I think there's a lot of different reasons for that. I think with the increase in fees for Nemacoggin, we're getting a lot of phone calls from people that we haven't had, ride our bus before. The other issue that we're dealing with, more and more people are using or have walkers or wheelchairs. So that limits how many people we can put on a bus at a time and how many rides we can schedule because it's a good 15 minutes getting them on the bus and getting them off the bus. So we've had to look at that and readjust our schedules for that. So we try to do a max of 25 to 30 rides a day, depending upon if we have wheelchairs or walkers or not. Our fourth quarter numbers will be done the end of January with a report to the state. And then I will do an annual report for the bus at the April meeting because that is due to the state DOT on August 31st. One of the things that I need to thank Andy for, last week, Shirley Armstrong and I, the SRC board president, met with Andy and talked about some in-kind options for the Senior Resource Center. Some of those were support for our IT. Instead of having to always source it out to someone and pay the expenses for that, when we had issues with IT, whether it's just something minor or when we go to buy new equipment, if they would help us, bid those things out and do those things. Also, we talked about maintenance and having the maintenance department. So staff doesn't have to take away from their jobs and go out and shovel the sidewalks and stuff like that. Get the maintenance department to use their machine to do our sidewalks on 5th Street and on California Avenue, which they're going to do. We've talked about that. And we have some minor repairs and stuff that we need to do. And we also asked if it was a possibility that the maintenance department could come in and look at the senior center because it is an aging building. It is 45 years old. And about the only thing that's been done there since it was built is a new roof and new furnaces and new upgraded the air conditioning department. So at some point in time, not today or not tomorrow, but take a look at, what needs to be improved, what do we need to fix, and kind of do a priority list. So we've asked, those type of things. And Andy has sent a message out to both maintenance and to IT. And IT has responded and said, anything you need, we're there to help. So we're, going on the right track. So that in-kind also helps with, the finances and stuff like that. So we will be tracking, and the county will be tracking what they do for us. Our in-kind rate right now that we use for all of our reports and funding for GWAR is at $25.66. So we will use that, as an in-kind match and track that. So, whenever I ask maintenance or IT to come over and look at something, and I'll talk to Tim about the number of hours or whatever it takes for them to plow or maintain those sidewalks, on 5th Street and California.
Thank you. Any questions?
Right. Hey, thank you. I'm
You-
gonna go take care of my pies.
I'll be over to
Yes.
taste test them later.
Pardon?
I'll be over to taste test them later.
Yeah.
Pies to take care of.
Jody, I have one question.
Sure.
When you keep saying you need cooks and that, don't you need, what is involved? What kind of training? If I knew someone that was really good cook, Do they have to go to schooling or pass a course or,
They,
yeah,
yeah, they
okay,
do have to pass a course. It's called Safe Serve. What
okay,
we typically do, and it used to be after 90 days, we ask that they take the Safe Serve class. We find a class for them, you know, we pay for it. You know, we pay for the class. It's about $150. We find one that's close. We also have enough people on site that have taken that class, have studied for it, that will help that person pass that test. What we are doing is we've extended that 90 days a little bit because the last two cooks, that we hired, we trained them, they took the class, they passed the test, and they left us for someplace else that pays more money.
oh,
So we're kind of like, you know, we're not, you know, rule of thumb is kind of like, you know, 90 days, but we're kind of like I know, like with the individual that's going out on maternity leave, just before she goes on maternity leave, she will hit her 90 days. But I said, we're gonna wait until after she comes back from maternity leave, just in case she doesn't come back from maternity leave.
right,
She has told us she would, but by the time, you know, we pay for the class, we do the mileage and bill, I think it's right around $300 a person. So we've done that a couple times now and it hasn't worked out for us. So we're just being a little bit more cautious now.
right.
But the Safe Serve classes, you know, a lot of it is common sense, knowing your temperatures, you know, how much, you know, bleach to put in your water, you know, different things like that. So
Mhm.
thank you. You're welcome.
Maureen, would you like to do your report now?
Yeah, I thought the roads were, it's slippery out there and it's getting a little harder and I thought it is there. But I'm glad I was able to join the meeting. I wanted to give an update from from our health center. It's one of the reports, one of the update on, because I haven't been here for a while, so I'm trying to catch up like things. When I have to travel and I have to be at state or national level, I'll be out of the area. But when I'm home here, I will be here. But so I'm just glad I was able to be here tonight. But the updated report I had received was COVID-19 is still a lull at this time. We had 3 positive tests last week, 2 yesterday, and none as of work today. We had 2 RSV cases last week and 1 influenza A. This may be misleading as some patients are staying home and dealing with that, with what they perceive to be flu or cold. We are asking patients presenting symptoms to see the provider. If you detect it early, COVID-19 influenza symptoms can be reduced significantly. We are hiring a new MAT recovery clinic director to be on board March 7th, 2023. Interim, Dr. Steve and our medical staff will be providing MAT support as needed. Amanda Suino will continue to see patients. We are currently seeing more patients due to our schedule change. Last year, the LPO Health Center seeing 8,000 plus patients. Our providers are working 4 2-hour days and staggering coverage as we are now open for extended patient care from 7:30 until 4:45 p.m. on weekdays. So that's an update where we're at with our clinic. And we are still in the process of working towards our new health center. We ran into some obstacles here and kind of delayed things, but we're still pursuing that project. And so hopefully we will see that someday in the future. I did get a chance to talk to our elder center directors also. And I was really excited to see some of the activities that we have for our elders at this time. We're trying to engage them in activities and trying to support them in ways, because coming out of the pandemic now, their mental health and the social needs that they need and emotional needs, because there are people who are grieving at all ages during the losses we've had during the past few years, and to give them the support that they need. So one of the things that stood out to me that I thought was kind of interesting was they're offering computer classes. Now we all know certain generations were exposed to that at one time at an earlier onset, and they grasped on and they mastered it. But there are those of us who didn't. So we learned as we went along. And anyway, so some of the elders now that fall into this age bracket, they have a couple sessions going on where they have 10 slots, which will have 10 laptops, and then they'll have the second session. Then they'll have a third, and it'll go on for some time, then it'll be theirs once they finish their training. So, and they have all 20 slots filled.
Great.
So this tells us they want to learn. It's fun for them. Then they can probably engage more with the younger ones and do things, but they want to learn. So it was exciting to see that. And the other program that they have for them exercising and trying to engage in fun activities and different things that we have going on, which I really am happy to see more and more of. And then with our new Elder Center, we'll be breaking ground this spring, and it should be completed by December. So that'll help our elders in the community to have a new facility. We're excited about that, and that'll be a good thing for our people. Some of the things that we're trying to address, we're trying to continue to address our homelessness and people who need that care and our facilities that we have at this time. The men's shelter had they had 12 men in the facility at this time with a couple beds open. Our other facility is for families, family oriented, for emergency shelter, the care that they need. And we have 9 people there, including a couple children, but there's rooms available now because people come and go. You don't know how long they're gonna need that support. And so we're trying to help them during those difficult times. We're trying to guide them to where they can have their own homes again. That's our goal. Then we have some COVID homes that we had during the pandemic that we are now using for emergency shelter and to help those who are homeless again, so that they can be with their children and families in a home setting to help them through that transitional period so they can get to another home. So we're utilizing our resources the best we can. Then we have Norwood Haven that we are developing and pursuing to have sober living. So we are trying to help those who are in recovery and those who, again, who are homeless, who are sober and healthy, and try to give them a healthy place to be again while they're transitioning. So these are some of the ways that we're trying to help our people, and then also provide them the care that they need if they are battling those addictions out there. And so there's some of the things that we've been working on, and there's so many things that are happening. I just wanted to update things and fill you in on some of the things that we're doing. So, for our facility, as far as education goes, all the things that we're doing there to help keep our people safe too while we're getting educated at all levels, from daycare to the really good start, head start, all the way up to the system. Here and now, in the public. That pretty much is my update.
Thank you. Anybody have any questions for Lorraine?
You said something about at the beginning that influenza and COVID symptoms can be reduced if detected earlier. What can someone do to reduce symptoms of influenza if they detect
I
it
think there's
earlier?
certain medications that can be given to offset that before it gets too serious. Once you go past a certain stage, then you have to go through the course. But if you catch it early enough.
Like
with certain
antivirals
medications-
or something? Is there, that's
You know-
really not, okay. I didn't know.
Yeah.
All right.
Catch it within like 72 hours.
Can I get that at Walgreens?
Can I get up there?
My kid's been sick, so.
Yeah.
I have a question. So many people are testing at home. I mean, I did. I knew I had it, so I tested at home. Is there any way that people get numbers? That anybody-
That's where we were at. We don't have those accurate numbers.
I
because
know.
People are, now they know what to do with the.
They take care of
they take care
themselves.
themselves.
Yeah.
And you know, with that emergency we had with the storm, we're trying to implement things quicker as best we can also. Because we had families without electricity for days.
Yes.
For days, and those who were out farther and could not get anywhere to get help or even get to the shelters that we had set up. We really are working on our plan, we're upgrading things the best we can, and the county and the tribe work together on the best things that we could do as quick as we could. And we're learning more and more to be prepared for it as best we can. You never know, And because we had those who, like I said, went days without electricity. So we had the casino, our elder center imposed, our community center, and then Signer,
Signer.
way out, the area
Reserve.
way out. Reserve elderly. Daycare center, certain facilities that have generators, like our lodge. Open, have beds, and people can bring those and blankets and food, provide food, we're providing food for all the community, not just tribal members, all the community that needed that care during those times. So we're trying to keep building on our planning and all the trees that went down and all the safety hazards with the lines that went down. I mean, it was not good. And then how we were trying to address things quickly as we could. The one thing I can say for the tribe is we invested in some plows in different departments, which was good, because then we sent out the plows as quick as we could. And we're still working on plans on how we can address these quickly, but that hit us hard and fast, the whole community. So whatever we can do for the emergency response is
Yeah.
important that we work on things together.
I'll just add, Chairman, what an unbelievable response that the county, the tribe and the townships working together. Hooking up generators to all these shelters, opening the lodge, like you said, and to see what. Julie and her team did here was amazing.
Yeah.
You know, we did not experience a fatality, but there were people in
Oh, yeah.
snowed in homes and couldn't leave for days.
Yeah.
Mhm.
Some who didn't want to leave, didn't want to leave their pets or whatever, you know. there's
Yeah.
Reasons why they did not want to leave.
And no heat,
No heat.
no heat in their homes for days.
Yeah.
Okay. Administration services list.
That's, again, just the list for you to refer to the services we need to, when we talk about things.
Um, So next is adult long-term care.
Yeah, Sarah submitted a report. I just want to highlight a couple of things. We're recruiting for that full-time administrative position that's accountable of the adult long-term care unit and the veteran services. And we have 2 candidates that we will be interviewing soon, correct? Okay. Also, I've talked in the past about that combo information assistant share position with Iron County. That position has been drafted and posted. So we're waiting for some candidates to apply for that. And one other comment I want to make about the new building and the remodel was that there's been some issues with the sound between the offices. I don't think I've worked anywhere where they've done a remodel where there, and Tim Hagbert said that the only way to prevent that is to put sand in the walls. I can't imagine that was going to happen. Can you imagine doing a remodel and drilling a hole, the sand comes flying out? So we did, Tim Hagberg, Sarah Sabecki, the supervisor out there, and myself did have a conference call with the architect about some things we can do to the offices. And some are just putting some inserts around the frame of the doors to kind of muffle that noise. And they do have some of those sound machines, those white noise machines to kind of help. But I don't think I've ever worked at a place where it's completely soundproof, but that's certainly the case there. But we're going to try to do what we can. Other than that, they seem to be settling in there. There's a few things that have to be done yet with maintenance there, but for the most part, it seems to be running okay.
Is Gary having the same problem?
He's way off by himself, so he doesn't have to worry about it too much.
Oh, okay.
So when you come into the building, hopefully sooner rather than later, you'll be able to see it. The remodel, you come in and there's a great big waiting area. Off to the right, there's a couple offices. That's where Gary's at. And then to the left, there's a series of offices where the bedrooms used to be. And that's where the adult long-term care unit is. So you can see that Gary's way off by himself.
Okay. Just curious.
Yep.
Let's see.
Behavioral health.
Yeah, go ahead.
You have Alicia's report. I'll just highlight CCS. I think I mentioned it previously that Shell Kettlehut, the CCS administrator, is going to retire. She has noted here as of January 6th, and they do have a replacement. And we did have a meet and greet over Zoom recently, and we'll see how that transition goes.
Hope it goes well.
So do I. You also have the mental health cost by client report. It's almost up to date. The only one that's missing from 22 is the December numbers.
Okay. Child Protection Services.
You have your usual CPS report and also the place report, substitute care for children. And then the youth justice report for your review.
Economic support.
And Mr. Bencher's favorite report, the economic support, is there. And it's a monthly report.
Mhm.
Things seem to be progressing as they usually do.
Public health.
Yeah, public health, before Julia might want to comment on a report, I want to echo what Mr. Schuman said. In the absence of the usual leadership for emergency response with the power outage, Julia stepped up and led the whole response to this, and it was remarkable. And also, I want to mention her two teammates from public health, Julie McCollum and Joyce Knowlton, who worked very closely with her. Julia will say that, she got to respond to everybody, but I want to say as a core, they really took it and ran with it. So thank you, Julia.
Thank you, Julie.
Yes.
Yeah, it was a lot of people, a lot of an inventor and a lot of people did pull together. So, and amazing, just want to reiterate, 7 Winds opening up, getting that convention center open. Heard from nurses who had hospice patients who were non-tribal that had a place, at one place to stay. So yeah, definitely helping the community. And winter school really stepped up in Wesleyan Church as far as places opening up and helping us. I did do an update from the respiratory report because things have been changing fairly rapidly. So
I got it on there.
did you get it in there?
I think so. Oh, yeah.
That was a nice last minute add there, Lynn. Yeah, so from the report, we're down to low for community level for COVID. And just to reiterate that we are having our last vaccine clinic at the health department this Thursday. We'll be relying on all of the other local resources. We really haven't had very many people utilizing it either. So, so as far as the respiratory report, we're down to moderate levels now in Wisconsin. So that is really trending in the right direction for us. I did add the Wisconsin map itself. You can see that we kind of borderline between kind of the high and the medium level, definitely are dropping off in the northern region, which is what we fall into in that red zone. And then just the other ones, I just wanted to update the graphs on. You'll see that we're really starting to decline in influenza rates. It is influenza A that we're seeing. Yeah, we jumped through another page there. Danny, do you have it? And then the next one is the slide just to show it is still influenza A, but definitely the testing has gone down considerably. And then the final slide or graph shows, you can see where we really spiked high for early in the season. So we'll continue to watch this. The risk of spiking high right now is we could have another wave that comes in like end of January, February that we'll want to just be watching for. Hopefully it's not the case, but that is where we're at. And as far as the emergency or the disaster response, we will be putting together an action report. We have the LEPC meeting happening next Wednesday. And so we'll get together with that. Also looking, we have Anthony Price, who has now been the new EM, right? So we've already had him involved, and Marv did an excellent job helping get him up and running, and expect participation from them. And so I think we're moving into a good session here, and Nicole Rapinski has been hired as the EM comms director. And so we're trying to, I think she's getting bombarded with a lot of information. We're trying to bring her on and give her as much support as we can.
LETC.
Local Emergency Preparedness Committee.
Okay.
Sorry, thank you. Otherwise, that is my update.
I got a question, Chairman. Did we qualify for any of that state funding then for the disaster
We
relief?
won't know until all of our expenses are in.
Okay,
It looks like we're over the threshold, but
Okay.
Friday is the deadline for having the estimates in.
Yep.
So we'll be turning those in Friday on for sure.
I think I owe you some numbers.
yes.
Any other
We're submitting
questions?
that too.
Any other
What is
questions
that
for
threshold,
Julie?
Andy?
It's $4 and something, 21 cents per capita. So roughly $80,000. So we've already got some estimates from like the Jump River Electric Co-op. They're eligible for some of that. I don't know if we have the LCO's numbers in, but we thought
They're coming in now.
those are gonna be up there. Just, I mean, the we're asking for estimates, even though that we know a lot of the actual cleanup is not gonna happen till spring, because a lot of the debris were
Mhm.
removed and pushed into the ditch, and now we're under, frozen in a foot of snow, so.
Yeah.
So this is just, we have to have the estimates in to get the verification that we qualify for reimbursement.
I have a question.
Go ahead.
So I've been hearing and reading about huge spikes in heart attacks and different cardiac events and myocarditis and stuff like that, and a lot of younger people like suddenly dying and stuff. I'm just wondering if you've seen any increases at all in our county here as far as younger people with any type of heart conditions or anything like that. Have we seen any here?
Your head, yes.
To Dr. Dunlap, and I haven't really been hearing anything.
No,
but-
as a trend, no,
Okay,
they're the odd, you know.
yeah. I don't know what to believe on social media and stuff.
We've had some cases.
Yeah.
Yeah, I was gonna say, Jesse, yep.
Hmm.
30,
Yeah.
right?
30?
Mid-30-year-olds.
Oh, my.
Hmm.
And what age group are you talking about?
35 to 40.
Wow.
I mean, we've been seeing a lot of like professional athletes and stuff, who are, phenomenal athletes and in great shape, and they're having heart attacks and stuff like that. So I just didn't know if there's any,
Is there any relationship to the COVID?
well, I'm not saying that.
No, I'm just asking if you think there is. You know, people are. Well, the side effects, that's what I was.
No, I don't think it has anything
You
to
don't
do with
think-
COVID, but I mean, the vaccine for COVID. Could be some fingers pointed in that direction. It sounds like, I don't know, but I'm not a medical, expert or health professional. So.
Well, I'll stay tuned into social media and see.
Okay, thank you, Julie. Yeah,
16.
yeah. There it is. A budget performance report. There we are. Anything, Paul?
Any comments, Patty, on it?
No, not really. We have, this is through November. And we do have our final month, but we also remember our 3 months behind in state institutions. So our final December has, will be quite a bit larger, but we're still projecting to be like within budget. I mean, it's still looking like we're gonna be within budget, but if you look at it right now, we've got $602,000, and you may think, oh, good, because we've only been spending, like 400, but December will wow you. I mean, because some of the things like foster care, out of home placements, actually December hits 2 months. Because we pay January's payments not until almost the end of February. So that hits our February disbursement. So in December, it's catch up and you've got 2 months worth of those things.
But that's the same year after year after
Yes.
year. So it's
So our
consistent.
December is,
It's
yes,
still
always,
consistent. Yeah.
and then, like I said, our state institutions come through our CARS reports, our community aids reporting system, and those are 3 months behind.
Purchase services recap.
Chairman, I got a question.
Oh,
for you.
that's what I was just wondering.
Patty,
That was it,
did we
okay.
see what we thought we'd see when we closed Oasis? Because we thought we were losing money there? Was that a positive thing to the budget? I mean,
Yes, I mean, because we own Sawyer County was promising that we were going to pay for 6 beds. And we were paying 6 beds to keep it open. And we only ever had 1 child there for like the last 2 years. And we haven't had any kids. And it was also opened as a juvenile justice facility. And if you look at the purchase service recap, we've only spent but $42,000 on juvenile justice services. And Oasis was costing us.
right. All right, thank you.
So we went from, when we first opened up Oasis, there was quite a few people there.
There was.
And toward the end here now, it's like you say, just one. Does that mean we helped everybody or?
Yes.
I can't, I mean, Paul, what's your reasoning? I mean,
I don't know, there
think
was
it's
an
also-
individual who used to work here to talk about the pendulum, so I don't.
I think it's also a shift in how the philosophy of children in at-home care also. I mean, the whole huge focus of the state is to keep kids in the home as much as humanly possible,
And this was kind of going against the grain.
you know, so I don't know how much of that had anything to do with it. I don't know.
I think that's probably a significant contribution to it.
But I mean, before you closed it, for the last 3 years beforehand, it had significantly, we hadn't had hardly anybody there.
Once you bring people in from out of county.
Well, yeah,
We did.
were trying to make it
Yeah.
up, but at the last year,
didn't
before we
work.
closed it, before we actually
Problems.
closed it, other counties weren't even using it, so it was like, well, we were paying all the bed space for one kid.
Okay.
We'd have one or, you know, maybe one kid from another county. We weren't making that money.
Okay,
I think part of it is too that, more efforts are being put into the home care that those families need, or the services they need. To catch them at that level before it reaches the level. And there's more.
okay, so other things have been happening that decrease the.
Yeah.
Okay,
Cause
that's
that's
good.
been a huge state initiative for the past, what, 5 years? Huge shift in philosophy.
Future agenda items.
Yeah, could we, I noticed last month that it doesn't have an item that says adjourn. And it might not be a big deal, but like every other meeting has it. So last month when I was, you know, it just kind of ended at correspondence. And I don't know if that needs to be on there or not, but I just thought it was strange. It's not on there. And it's on every other committee meeting. You know, a space for adjourn, agenda item.
Let me look at,
The other committees that I shouldn't speak for every.
zoning.
Yeah, zoning and water.
Okay, so I'm on public works right now. I mean, it's good.
It doesn't?
Yeah.
Oh, it says-
The others don't, maybe it's just zoning. I don't have it on any of the others.
Okay, all right.
It's funny how things keep shifting.
It's never been
One
on,
more thing before,
because I never took it off, so.
It's on the
it's never
full,
on
the
there.
full county board meeting though.
Yeah, yeah.
So let me look at the full county board.
Maybe there's a reason why it's not on there. I just thought it was weird when last month I was like, was just I put pause because
Uh-huh.
I thought I was supposed to adjourn, but it didn't tell me to. on the agenda.
Yeah, it's not on any of them, so if you want them on, let me know, I'll put them on the template.
I was just,
Yeah,
I'll check again.
and the old building, you're gonna use that for something.
There's traditional and a lot of places to have it on there. I don't think it's required.
Just a little
The chair can do it in the meeting there, there's no more business.
If they've gone through the full agenda.
I'm so happy.
all right,
Yeah. That's so.
Adjourn.
all right. Wait, of course, you didn't do number 18,
No.
did you?
okay,
No correspondence? No.
oh, I'm sorry. Actually, there was something I was going to say,
I know, I
especially for
was
the
surprised
county
when I
board
came out.
members.
My
Have you
copy
seen
was
the copy
nice,
of,
if I'd known that,
excuse me? Hey, people,
Sorry.
Ms. Lyons,
Yeah.
sorry, we're still,
okay.
We're done.
Especially for the county board members, have you seen your copy of the Wisconsin Counties Association magazine? There's, the whole magazine is pretty much dedicated to mental health issues. And they're touchy. I haven't read the whole thing myself either. I'm still looking for the part where the state's going to start paying for it. I don't know if I'm going to find that or not. But it's an interesting article. You might want to take a look at it. So anything else for correspondence? Okay, now we're adjourned.
Thank you.
Thank you.